Hi, my name is Dr. Young Liu. I am an assistant clinical professor at City of Hope, specializing in genitourinary cancers, and I am a medical oncologist. So the study I wanted to talk about today is cohort 6 of the COSMIC-21 study, which is a phase 1b study looking at the combination of Cabozantinib, which is a tyrosine kinase inhibitor, combined with Atezolizumab, which is a immune checkpoint inhibitor, and seeing how patients with metastatic prostate cancer responded to this particular treatment. One of the key reasons that this study was of particular interest is that it is one of the first studies, or one of the few studies out there, that shows efficacy in metastatic castration-resistant prostate cancer combining a TKI and a IO agent. And so the way this study was conducted is that they recruited patients that had radiographic progression in soft tissue after getting an anti-androgen such as enzalutamide and or abiraterone prednisone. And the other key eligibility criteria had to be that the patients had a measurable disease based on RECIST 1.1 in the soft tissues or extrapelvic lymph nodes. And prior chemotherapy was not permitted, with the exception of getting docetaxel for metastatic castration-sensitive prostate cancer. So for this clinical trial, a total of 132 patients were enrolled, and 101 of them had visceral and extrapelvic lymph nodes. And all of these patients were metastatic castration-resistant prostate cancer patients. And what this showed was that the treatment of combining Cabozantinib and Atezolizumab showed significant efficacy, with the overall response rate, including all partial responses, of 15%, whereas a pretty significant disease control rate, which includes CR, PR, and SD patients, of 84%. And furthermore, what was also noticed from this study was that the overall adverse effects were tolerable, whereas having only 20% of patients discontinuing, and the adverse effects themselves were consistent with what was expected from administering these agents separately, such as diarrhea, fatigue, and some IRAEs such as dermatitis and hand-foot syndrome, which comes from the use of Cabozantinib. So the key take-homes I would like to say from this particular study is that it is significant in that it shows combining non-cytotoxic chemotherapy for metastatic castration-resistant prostate cancer patients using an TKI and IO agent is beneficial. And in this phase 1 study, there was good safety signals and also meaningful clinical responses. And the investigators now are further investigating to see if this combination is effective. A larger phase 3 study, which is the CONTACT-2 study.